And many kids are spending their evening at the ballpark, of course. It's Little League baseball and softball seasons, and it's not uncommon for kids to come home from those games with an injury. But how do you know when they need to make a trip to the doctor? Dr. Matt Dumigan is a doctor and with the McBride Clinic and joins me with more. Thanks for being here.
Thank you, Tim.
You said this is a busy time of year for you.
Yeah, it really is. I mean, this is with baseball season is probably one of the most frequent overuse seasons that we'll see in our patients, and one of the trends that we've definitely seen over the last few years is both the length of the season, the intensity of the training, and earlier sports specialization has really increased, and I think with that's come a higher incidence of overuse type injuries in the kids that we see this time of year.
You mentioned the longer seasons. That doesn't help. Do you recommend then varying up the sports to use different joints and parts of the body?
Sure. I mean, that's a really good point, and I think particularly on the younger kids, the emphasis really should be on focusing on sound fundamentals and good sportsmanship, not how to become a professional baseball player when you're 8 years old. So definitely to avoid overuse type injuries, the things that we probably see most frequently this time of year are shoulder and elbow injuries on young kids, and it's just from repetitive throwing and not having enough rest in between outings. So changing up the sports, having an appropriate period of rest, I think are all important to try to avoid these things.
I think a lot of parents are probably looking for a bullet point. Can you help me with some ages? Because you talk about a season of baseball that goes all year. That's trouble for a child who's developing, or he or she. So can you share with us what we need to look out for in terms of age to go that long with the sport?
Sure. Well, in terms of baseball, our society has recommended 3 months minimum of complete time off during one calendar year where there's absolutely no baseball activities whatsoever. Our academy has also developed pitching parameters for instance, a pitcher under the age of 14 is not supposed to throw curveballs and off-speed pitches because they seem to have a higher risk of throwing acquired shoulder and elbow injuries. We also have pitch count parameters, amount of rest between starts, and that's all based on age and is readily available.
And for those at home who may not believe how serious it is, you've seen children with permanent damage.
Really have, that continue to play through the pain, which just can't possibly recommend to anyone, especially in that age group. I think that parents and young athletes are guilty of getting caught up in the moment, and that the next tournament's a very important thing, and we got to be careful. And
can you quickly just share with our viewers, you shared this with me, and it's really shocking, the experience you had with one 8-year-old who came in with damage.
I had a really a good little athlete for his age who had a severe throwing acquired elbow injury where a large part of his growth plate was ripped off the inside part of his elbow. And the question from the parents was, after you fix him, can he throw with his other arm while he's in a cast? And so that's hard to figure out. Time to rethink some things. Definitely. Doctor, we appreciate you being here. Thank you, Tammy. And sharing the warnings. For more on the McBride Clinic, go to news9.com/first at 4.